Yes, right now we are talking about another celebration.
That's right, this is an institution really. Been around for 50 years, celebrating their Golden Jubilee. So we have in the studio to talk to us about the Golden Jubilee celebration of Hospital Bersalin Kuala Lumpur, Dr. Ravindran Jekasudi, who's the Chief Department of Obstetrics and Gynecology at HKL. Very good morning.
Hello.
Good morning, Doctor. Right. So how does it feel to celebrate the 50th anniversary of the Golden Jubilee?
We feel excited. We don't feel old. We are still excited to work hard.
And how has the hospital evolved?
I think it has evolved tremendously. We first started exactly on the 18th of January 1963. And in this first year of operation, there were 10,064 babies that were delivered. And you want to guess how many babies have been delivered so far?
After 50 years, if we just times that number by 50, we might even come close.
Millions.
916,000 babies.
Wow, that's
have been delivered at the Maternity Hospital KL till to date.
Quite a lot. Because if you
almost
think,
1 million.
Yeah, it's almost 1 million.
That's a
Because if you
large
think the early
workload.
figure, that's a huge number.
Yeah, it's and at one time we used to deliver about 28,000 babies per year.
Wow.
1988.
Wow.
Now we deliver a more reasonable 12,800 babies a year. The reason is because we have many other hospitals around KL now. There are choices. But the maternity hospital still remains the doyen among obstetric and gynecology practice, because it's the main referral center for many of the complex ONG cases in Malaysia.
That's right. Well, it's still early in the year. How many New Year babies did you deliver this year?
I think we had about 32.
32 New Year babies.
Is that the most?
No, generally I think on a day, on an average day, we deliver about 40 to 50 babies a day. Of course, you have the quiet days as well. The change in practice now, of course, is the rising caesarean section rates compared to previously.
I see.
Previously, we used to be about 10-12%. Now it's about 27%.
I see.
So
it's getting a normal occurrence.
That's right.
Yeah. So maybe could you share some of the interesting stories that that happened in the hospital for the past 50 years that maybe many people don't know anything about HKL?
I think we have had successes as well as problems sometimes, right? I think the problems were because of the crowded nature of the hospital. You can imagine with 28,000 deliveries, it was almost like a factory line, right? But now we have our successes, in the sense that we have developed our subspecialty services. So very complex operations as well as procedures are done in the maternity hospital. To quote some examples, we are one of the public hospitals that does in vitro fertilization, right? The test tube babies, so-called, right? We have even got frozen embryo babies, right? Where we can freeze the eggs and then re-implant them later. Then we have got maternofetal division that looks at treatment of the fetus in utero, right, prior to delivery or planning its delivery, and after having diagnosed the problems with the baby. We have a strong point in the management of multiple pregnancies, twins, triplets, and so on. And you would have heard of some of the conjoined twins that are delivered at the maternity hospital and then subsequently operated by the pediatric surgeons at Hospital KL. So, and we now have a gynae oncology division where we treat the cancers that women get. Now we have the whole range of services that are there, including radiotherapy and chemotherapy services. Then we have the urogynecology service where we treat the incontinence problems of women. So now all these were not there before, but we have developed it over the years, and I think the maternity hospital is well known for its training. I would not be wrong to say that almost every obstetrician and gynecologist in Malaysia has passed through the maternity hospital at some point in their training period. So there have been difficult cases that we have successfully managed. There have been patients who have had over 40 units of blood transfused to save their lives, and they have walked away well. At the same time, we have had deaths, for example, where we couldn't do anything very much to save them. But we have learned from every difficulty and become better, I think, over the years.
Doctor, you alluded to the fact that, of course, this is the main referral center for difficult cases and ONG complications. So have you set any precedents in medicine when it comes to cases of the ONG nature?
Well, I think we can't, I think mainly is the multiple pregnancy issues. And of course, when we talk of the public hospitals, the first IVF baby was in the maternity hospital. And, we have actually set the trends for the ONG practice in Malaysia. For example, the setting up of the early pregnancy assessment unit was set up in the maternity hospital. And generally, we have looked at evolving the systems of care in the public system. Most of it has evolved from the maternity hospital. So I think that is our strong point.
And we've seen the departments of ONG set up in various hospitals, also both being public and private. What's your comment on this, having more hospitals to provide these services?
Yes, I think that's a natural thing to have as we develop as a nation, that care comes closer to your home. But at the same time, I think each hospital develops a niche area in which they are strong at, and then we refer among each other. So our niche areas have been the maternal-fetal division and the IVF division, the reproductive medicine division.
Are there any prominent leaders or celebrities that who
there have been many actually. Yes, there have been many. There have been ministers that have, current ministers who have delivered in the maternity hospital, royalty who have delivered in the maternity hospital.
Will any of them be attending your events?
Well, we hope so.
Yes. I'm sure you extended an invitation.
Yeah, that's right. We will. We actually want, we are going to have various events over the year. We are going to have public forums, for example. We are going to have, if possible, some of the twins and triplets who have delivered with us come together for a celebration. We want to have feedback from the people who have delivered. We have many doctors actually who have been delivered in the hospital and have come back to serve us as a specialist.
That's a nice
in
story.
the same hospital. Right? And they have even come from overseas. They have been working overseas. When they come to Malaysia for a conference, they make sure they drop in at the maternity hospital and take a walk through its corridors.
Right.
That's really nice. I have to go back and check my birth cert now, find out where I was delivered so I can go back and check out the place.
Private hospital. So with the Golden Jubilee celebration as well, the increasing number of mothers delivering at HKL, what are some of the improvements that have been made or you plan to make at the HKL? At the hospital?
I think the main planning now is for a new Women's and Children's Hospital, a 12-story block that will occur hopefully within the next 4 or 5 years.
Within the vicinity?
Yes, it is within the Hospital KL compound, but not exactly in the same location.
Right.
All right. So that will provide us additional space and better flow of patients for better care. But of course, within the complex itself, we have upgraded our equipment to sometimes very high end. An example I can quote is, for example, we do perform robotic gynecological surgery. Right? So that facility is available in Hospital KL. And all equipment that is usually used within the ONG fraternity is found in the maternity hospital.
Doctor, we're moving towards the developed nation status, and it's often quoted, doctor-to-patient ratio being as one of the indicators of a developed nation. Is there an obstetrician-to-patient ratio?
Well, there is no definitive ratio, but you find that when we look at the Malaysian scenario, we have more obstetricians in Wilayah Persekutuan than the other states.
I see.
Right? So in that sense, Wilayah Persekutuan is well served. But some of the other states do have a need.
All right, so we're well delivered here in the
No pun intended. No pun intended. One of the grouses, or basically what people are concerned about, is the lack of parking space.
Yes.
In HKL. Is that, since there's going to be no new women's and children's center being developed, will the parking spaces also be upgraded or looked into?
Yes, definitely. I think let me assure you that the management at Hospital KL has always taken it very seriously.
Yeah.
Right? There have been constraints, but the new Women's and Children's Hospital will have its own inbuilt parking, which will give additional space to the hospital. And I'm sure the Minister of Health will tell us tomorrow when he comes what his plans are for improvement.
Speaking of tomorrow, Dato', what
Yes.
are the celebrations like?
Well, we start off tomorrow with the Minister of Health launching the 50th year anniversary. And actually it corresponds to the exact date that the hospital was launched by the previous Queen of Malaysia.
Yeah. 18
Alright,
January
yeah. And
1963, right?
Yes.
Yeah.
And throughout the year, we will have various activities, including to stress on the strong point of our hospital, that is training, professional conferences where doctors will gather and discuss improvements and developments in the ONGA field.
So these are basically events which are planned
Yep.
for the entire year.
Yes.
Tomorrow's ceremony, what time does it kick off, and can members of the public, especially HKL babies, can they attend?
Yeah, I'm sure they can. I think the minister is slated to come at 3:30 tomorrow to officiate the function.
That's great. And what other activities or events you have planned for the rest of the year?
We have public forums. We have blood donation drives.
Okay.
We have, as I said, the gathering of the babies. We have the professional conferences and many more. We hope to come out with a 50-year history of the maternity hospital, including a summary of all the doctors who have passed through our hospital, as well as some of the remarkable events that
I'm
occurred.
sure it's all well documented. It's like an archive, right? Yeah. You should publish a book.
That's right. We would. We hope so.
Yes,
We
okay,
hope so.
that's
Thank you very much, Dr. Doctor, for being here with us and sharing with us your 50 years as an institution. And we wish you all the best for your celebrations tomorrow.
Congratulations.
Thank you very much. Yeah.
Right.
Thank you.
So
There you go.
yes, yeah, we hope you can
Check your
all
birth
the
certs.
HKL babies out there. Make sure you make your way there tomorrow and celebrate with everyone. Well, most of the people who are involved. And
Your fellow 980,000 babies who were born there
Why not?
at HKL, Hospital Bersalin Kuala Lumpur.